This section will focus on HIPAA enforcement. Client autonomy is a critical component of privacy. Service providers respect and promote client autonomy by engaging the client in all aspects of service delivery. Clients participate in decisions to refer them to other services and in the development of their service plans. The privacy rule has three important objectives. 1. To ensure a uniform level of privacy protections are enforced throughout the nation by limiting how health providers and health plans can use a client's personal health information. 2. To provide clients with rights related to their information, including the right to access their medical records and the ability to have any errors in those records amended. And third, to ensure that clients understand how healthcare providers and health plans will use their personal health information. So why do we need to protect PHI? 1. It's the law. 2. To protect our reputation. 3. To avoid potential withholding of federal Medicaid and Medicare funds. And 4. To build trust between providers and patients. To serve their clients more holistically, staff will be able to access information about their clients across programs in these systems. To comply with the privacy requirements, staff will be given access to client information in the systems only as legally permissible and as needed to do their jobs. This is known as HIPAA role-based access. For example, a healthcare provider in a DHHS clinic will have broad access to client information across programs. Information about the client's housing situation and other needs may be important for the provider when making decisions about treatment. The new client record systems would enable some staff to have a broader vision of services that their clients receive, and it is expected providers will communicate more about the clients they serve. Increased access to client information means staff will have an increased responsibility to protect that information. Be sure to safeguard the information you access. The new client record systems will create an electronic access log documenting each time a staff member accesses confidential client information in the systems. The department will use the logs to monitor access and to ensure that staff members are accessing information only as necessary to do their jobs. Creating and monitoring these access logs is a HIPAA requirement. Who or what protects PHI? The federal government protects PHI through HIPAA regulations. For civil penalties, up to $1.5 million a year is assessed for identical types of violations. For criminal penalties, a $50,000 fine and 1 year in prison is assessed for knowingly obtaining and wrongfully sharing information. A $100,000 fine and 5 years prison time for obtaining and disclosing through false pretenses. And a $250,000 fine and 10 years prison time for obtaining and disclosing for commercial advantage, personal gain, or malicious harm. Our organization also protects PHI through the Notice of Privacy Practices, and you protect PHI by following our policies and procedures. It's important to note, willful neglect violations are mandatory. HIPAA defines willful neglect as the conscious intentional failure or reckless indifference to the obligation to comply with the administrative simplification provision violated. Thus, using "I didn't know that HIPAA required or prohibited that" no longer offers valid protection against violating the rules. HIPAA regulations are enforced by the public, the department, the county, the Office for Civil Rights, and the Department of Justice. The public is educated about their privacy rights and will not tolerate violations. They will take action. The Department of Health and Human Services staff is well trained in HIPAA, and all complaints will be recorded, investigated, and disciplined accordingly. The department has a health information privacy officer to manage day-to-day HIPAA operations. Montgomery County has a robust privacy compliance program in its role as a covered entity. The county is a hybrid entity, meaning some of its agencies are covered and some of its agencies are not. As of February 18, 2009, Section 13410 of the HITECH Act gave the Maryland State Attorney General the ability to enforce HIPAA by bringing civil actions on behalf of residents of the state of Maryland in federal civil court. The Office for Civil Rights enforces the privacy regulations, providing guidance and monitoring compliance. And the Department of Justice involved in criminal privacy violations. They provide fines, penalties, and imprisonment to offenders.